Just going to introduce Dr. Oren here. Here's some things about him. He is the director of the School of Public Health and the Prevention Research Center at San Diego State University. He is also a professor of epidemiology. He is trained as an infectious disease, respiratory, and social epidemiologist. And through the Prevention Research Center, housed in Imperial Valley, he seeks to mitigate the adverse effects of extreme heat through evidence-based interventions, education, and policy advocacy. Please welcome Dr. Oren.
Thank you. Can you all hear me? Seems pretty loud here. Okay, great. Thank you again for that introduction. I will say, maybe like many of us, I sort of have, I won't say stumbled, but come into this field as both world of climate change has taken center stage, and also as there have been different collaborations and opportunities. And it's really thanks to this group. I was just thinking that I came the first year and then I presented last year and here again, that I've kind of seen some of the possibilities and potential across sectors, across mentoring and training. So we'll definitely welcome discussion and thoughts. So specifically, I want to talk about our Prevention Research Center, which is based out of Imperial Valley. And I also want to mention, we've got Dr. Zavala here. I'm not going to put you on the spot too much, but as also a research PI of our project, and Dr. Quintana, let's see, but let's go there, also at our project. And it always takes a team, and not just an academic team, but a collaborative team across community and different groups. It's interesting. I saw the earlier slide that was put together, and obviously we all think alike. When I was preparing this, you can see the data I was preparing these slides. I pulled this, I think it was like an hour before the slides were put together, and it was just the same kind of thing. Like, this is what's in the news, and I don't need to go through this, but talking climate change, but specifically extreme heat events, they're all over the place. It feels like all the time. So I also won't spend a whole lot of time sort of the preamble, but I will just mention we think of heat in different ways. Obviously, when we start thinking from a physiological perspective, a mechanistic perspective, we really think of how heat affects individuals in different ways and the different kinds of risk factors that may vary across different individuals and different groups. And that's really kind of where we want to go in the long run, is really think about that. Think about these different populations that are affected. Why are we doing this work in California? Why in Imperial Valley? Probably not to see too much to this either, but California is where most of our heat burden actually occurs, and part of that is because of the weather. Part of it is because we have 40 million individuals in the state. But if you look at these graphics, without going into each of these graphs in detail, which I data guide, that's what I like to do, but you can just look on the left and you see CA pretty much on the very far left, or second from the far left, in terms of the numbers related to different kinds of hospitalizations. For all hospitalizations, different specific types of hospitalizations related to cardiovascular events, respiratory events. So when we start thinking about the desert region, we really do have to, you saw earlier the discussion around the different phases, different emergencies around heat. We are really looking at a different kind of ecosystem where temperatures are already really hot and are projected to increase even further. This particular slide just shows some projections that were put together by a team that's been working out in desert regions, specifically in Imperial County, for quite a long time. And it's a little bit hard to see. I think this was told this laser pointer wasn't working. Quite see, but that little light blue on the right shows you that in the next couple decades, we expect about up to a 6 degree increase, 6 degree Fahrenheit increase in temperatures in Imperial County. And that's really substantial when you already have a baseline that's very, very hot. Imperial County is also unfortunately leading the way. If you look in California, we just talked about the burden of heat-related hospitalizations in California, across the nation in California, leading the way. But now if you look at California, that orange bar, and then look at all of these different counties, you can see Imperial on the very far right there when we talk about visits to the emergency room. Part of this is the climate. And part of this is also the socio-demographic side. And I don't know if you recall, looking at statistics during the COVID pandemic, but the COVID pandemic did not hit, or was not hit, I guess, it's not a different word, but all counties the same way and areas the same way in California. And once again, we saw that Imperial County was, if not the first, then the second most vulnerable county during the pandemic as well. Is that because of heat? Heat. We can talk about that too, but really there are these other factors, these social vulnerabilities. And in Imperial County, you see a higher poverty rate, you see higher rates of other comorbidities, and it's really the interface across these different areas that we're concerned about. You obviously also have a county that's highly agricultural, a lot of migration back and forth across the border, so a lot of outdoor exposure. So I want to mention, as a sort of further preamble to what I'm going to say, you heard earlier about what San Diego Health and Human Services Agency is doing, and I'm inspired by that vision. I also want to put out this broad vision that's really an agenda that's inspirational, I think, but also potentially up in the clouds, but what we would like to aim for, put out by the Federation of American Scientists. And I actually have two slides here. I'm not going to read this out to you all. You can probably read faster than I can keep talking. But I want to make it clear that there are ways forward that are possible in a very structured environment around thinking about policy change. And if you start scrolling through these, you can see that it's really a mix of things like tax rebates, stronger governmental policies around heat injury events, transformation of the landscape. And to some degree, I want what I'm going to present to fit into this inspiration, to think about this. And what I'm going to talk about is not going to be able to speak to tax credits per se, but we are really committed to thinking about how heat action planning in the future fits into this inspiration. So there's one slide. So let me just make a note about who we are, what we're doing. So San Diego State University has one of 20 federally funded prevention research centers. These are centers that have been around for decades. We actually used to have a prevention research center that worked on chronic disease issues. And specifically the PRCs, as they're known, are there to deal with applied health issues that are really taking in community input, feedback, and more to basically co-manage and work forward on different public health issues. These 19 other centers, many of them are actually in other areas as well, are committed to what I'd call more classic kind of chronic disease issues of obesity, physical activity, nutrition, the list goes on. We're actually the only center that's dealing with an issue that relates to environmental justice. And to my knowledge, the only one in the history of this long-standing network that's dealing with this, where our primary focus is really on extreme heat and UV-related as well, ultraviolet related exposures. So what we're looking to do is to specifically reduce the health impacts of extreme heat in Imperial County. And we started to do that. We'll continue to do that through evidence-based interventions, education, policy advocacy. And as I mentioned earlier, we're really looking to work and partner with these different groups where we know that there are additional vulnerabilities. We do this primarily in partnership with a community-based organization, Comité Cívico del Valle, and that is a group that has long-standing interests and history in Imperial Valley, and has really served as a community voice for a long time in this arena. We also partner with the Health Department of Imperial Valley and other organizations. I won't speak too much about this, but just if you're curious, especially if you're training and so on, I mentioned the PRCs earlier. They are funded by the Centers for Disease Control. They always have a research project, a network, and a center. The center is a hub, it's a resource hub. The research is some of what I'll speak to. So I mentioned just in that slide right before the last one, what it is that we want to do. And really in terms of the step-by-step, what we are working and moving forward, because what we want to look at is how to adapt heat action planning specifically to this region. A region that is largely dispersed, more rural, more agricultural. So it looks very different than a New York City, right, urban heat plan. And it also will look quite different than the heat plan that we are basing this on in Phoenix. And what we really want to be able to do is to be able to test some of these specific strategies around heat action planning to see how they work, how they can be customized in these different ways. So I think I already talked to some of this. So largely this is based on what we call community-based participatory research. There are other terminologies used in this world, but focus on the idea of CBPR, which is really a collaborative approach. It takes community voices first and involves community members in every single stage of the process. So this is not a sit in the office behind the computer sort of approach. Certainly we all do that a lot, but it's really an approach that's probably much more slow, hopefully thoughtful in that regard, where we're being very conscientious of what different people have to say, and that so that the end product is informed by these different voices. So that's this overarching idea of an approach, and then what we are trying to do then is take these known evidence-based interventions. You heard about some of them earlier with the cooling spaces, and basically say, well, how do they look in this region? So we'll see more about that. So let me talk a little bit about where we are now, and then where we want to go. So we're in the first year of our PRC. And the first step in this process is really in obtaining understanding from these community voices of what the problems are, what this looks like. And I will say, if you look around, you do your PubMed searches and whatnot, you see there's a good understanding of what kinds of problems people might face around the globe. But what we don't see is information that is specific and local to different groups that are affected. That's our intention. So we are really, I should step back and say, our approach here is to work closely with first a community advisory board, and then with broader audience stakeholder recruitment to understand what this looks like. So I kind of outlined a little bit of the process here so you can see it. And we are in the process right now of conducting interviews with various stakeholders. These are both professionals working in different organizations, and then also individuals who are affected in different sectors. So we might think of those sectors as agriculture, education, health, right? Heard a little bit earlier about sports. I was thinking about that. We actually have a representative sports individual in there. What does that look like? And these are fairly in-depth interviews. So this is really, for those of you who've done qualitative data work, I trained as an epidemiologist, it's big data. This is much more in-depth, narrower scope in the sense of numbers, but going pretty deep in terms of motive. And so where we are with that is really in terms of getting that information across these sectors and then sharing with key partners, and then using that information to inform what we call implementation science approaches and strategies to dealing with extreme. So I'll give you a couple of examples. These are the types of themes or topics that we cover in this. So what is extreme heat? What does it look like? Do people know about heat action planning? Is that something? Actually, let me ask you all here. You've heard about heat action planning. Raise your hands if that's something. So, right, started looking these up. It was mentioned this morning, it's one of those 3 documents, right? San Diego has a heat action plan. Imperial Valley has what I would call some sort of heat action plan, but not a heat action plan that is informed. And then very specific things, personal behaviors, exposures, resources that exist in the community, messaging. What are people aware of in terms of messaging? What messaging would they like to see? And what sort of supports and training would they like to also see in the future? So here's a sample, kind of types of questions you might ask. So how people might describe heat, how do they feel it, who they think is most vulnerable. And then we actually provide resource sheets with little graphics and examples of things like cooling centers, areas, and so on. So people can look and prioritize the types of items that they think are most important. And then specifically, we are also asking them about these strategies from other areas, such as Phoenix, hot, urban, distributed region, not so far away, right? I think there was something just yesterday that was about Phoenix. I think another record, which is the hottest city in the West. But really some of these strategies and how they might apply to emergency here. So the idea is that we take that information and then we really think about what we call adaptation and how we can adapt to mitigate these effects. And so you heard an example earlier. These can include a variety of different strategies. So cooling solutions, like we find places that are cooler to lower that core body temperature. Education, urban planning, emergency response systems. So there's really a broad array of these, and I think I have a couple more examples in a minute. These are specific examples that were raised in this Phoenix Heat Action Plan. So you can see those are very similar to the prior slide, but give some specific examples. You can see that things like tree planting, reflective roofs, these are really, really concrete strategies that areas can take to do some of this mitigation in shorter term. And then we are basically taking that information, right, and then collating this list, these different strategies to then look at how we can better both inform communities and get information from communities. So here I list a broader 9+1 other strategies, right? Kind of listing of different types of things that we can think about. And these are ideas that have come up very specifically in working with our CAD that are emerging from the census system. So I just want to show you, I think I'm almost at the end here, so it's okay. Some of the examples, I actually showed this in a breakout last year from the Phoenix Heat Action Plan, because I think they're really, I like the visuals. These are not my photos, it's literally from the plan, but I think they're powerful. And so I have 3 slides here that just illustrate the power of these narratives and these community voices and change. This first one is around different bus shelters, bus stop designs. And if you look at the slide, actually I'd like to do sort of a little mini quiz here, not really a quiz, but where would you prefer to hang out? Is it A, B, C, D? Okay, none of you. Okay, it's just too hot. I don't want to be outside. But if you have to be outside and you're waiting for the bus, I agree. And if you sort of read the fine print here, you can see D is the gold or standard, right? It's a bus shelter with artwork, trees, landscaping. So it's just metal structure. So, okay, another example here is actual a study that was carried out around evaporative misters along the shade. It's like a restaurant area in the city of Phoenix. And you can see, once again, these different types of environments. It's a little bit harder to discern just from the visuals, but essentially you can see from the top there, you've got shade, no mist, sun, no mist. So that's actually kind of your worst condition. Shade and mist, sun and mist. And basically, this is actually a little study that showed, not that surprisingly, that the condition with both shade and mist is more. And again, this is not high level. I mean, there's a cost involved, but it is not cost. And the final one I just want to show is really thinking about, I think this is very broadly applicable, the general walkability and shade structures. And these were different images that were put together. And I was trying to actually think about how, this is a couple of years ago, AI could add layers to this at this point. But but different visualizations of environments that would be both more comfortable, just more appealing to me in the first place. Imperial County does have an extreme heat response plan, so I want to highlight that this is not happening for blocking. There's a lot of thinking that's been taking place on this, and so these are the elements that come from this heat plan. But I also want to note that what we're trying to do is different ways, thinking about these bigger picture items. So that's really all I have. I want to thank you. We do have a center website. So interest involved.
All right, that was a great presentation, Dr. Oren. Very, very informative. Our next speaker is Dr. Perajuli. Dr. Perajuli is a research scientist and adjunct faculty at SDSU. He has expertise on regional weather and climate modeling, focusing on extreme heat and air quality. Dr. Perajuli is also currently serving as an editorial board member of the Nature Portfolio Journal, Communications, Earth and Environment, and deputy lead editor of California's 5th Climate Change Assessment. Please welcome Dr. Perajuli.
I have. Thank you. Thank you for the introduction. Yeah. So thank you. Good morning, everybody. Thank you for being here this morning. And I will be now taking you a little deeper into the topic of extreme heat. How do we model it? How do we measure? How do we monitor it? And what we are doing. So let's get started. So that's the title of my talk. But yeah, just to reiterate, yeah, I work at San Diego State University, and yeah. So this is actually an ongoing work, but it's coming towards the end. We have a project funded by University of California Office of the President, and we are an interdisciplinary team of epidemiologists, public health people, climate modelers, and remote sensing experts. So it's a big teamwork, and so the research questions or general questions that I will be introducing today is, how does irrigation impact spread? As you know already, that humidity is a key contributor of heat spread. So, and how does heat exposure vary in agricultural settings? How often are heat spread thresholds provided? Public offices, thresholds are exceeded in crop yields, and what are the rest break requirements for farm workers? As you know, while working in everybody needs rest, so does farm workers, right? So, and we try to quantify how much rest break do they really need in different environments, and what are the predictors of heat-related ED disease. That is very important, right? So, what can we do to predict them beforehand, weekly scale or a longer time scale, different settings, right? So yeah, again, just to give you some highlights of why this reason is important. As you know, farm workers are the frontline workers of our food system. They are 35 times more likely to die from heat stress than other workers. And in the Imperial Coachella Valley region, over 60,000 farm workers are active even here. These numbers would be underestimated again because there are a lot of workers coming from Mexico to work every day. Not that counted. And this region is actually also known as the salad bowl of the United States. Produces 2/3 of the winter vegetables and also 1/3 of fruits and nuts consumed in the year. Unfortunately, Imperial County has the highest heat rate in yeah, know now. And one of the important things is this area is highly irrigated. The uh, annual rainfall is just about 3 inches of rain, but irrigation applied is about 5 to 6 feet. So that's a way lot, right? And that is what so and so yeah, a few pictures from the area. Different crops are grown there. And now, so yeah, let's talk about quantification of heat right now. You already know temperature is widely monitored, widely used to monitor heat spread, and there's another term called heat index, right? Which gives you a feels-like temperature that you see in Google or any other applications. But for for a more accurate measure of heat stress, we use something called wet bulb low temperature because it goes further than heat index and it also takes into account effect of direct solar radiation. For example, farm workers are working daytime direct sun, right? So we also need to take that solar radiation, not only solar but also thermal radiation coming off from the pavement, right? So this indicator takes into account like the humidity, of course, air temperature and solar radiation. There are different components. That's the wet bulb temperature that takes into account the center is the wet bulb temperature that takes into account the humidity. That's the wet bulb temperature. The way it works is we all know humidity creates additional. How does it do? Is in high humid environment, our body cannot cool down by evaporation of sweat, right? Basically, our body cools down by evaporation of sweat, but high humid environment that is restricted that creates additional heat. So and our term black low temperature that takes radiation weighted average of all these components that gives us this metric wet bulb seeing more often nowadays. So yeah, and so this WBCT was actually first used in 1960 after there were about 600 integrated casualties, Marine Corps recruit for training in South Carolina in a single summer. And they installed these WBCT sensors on site. And after that, after 2 years, they closely monitored the situation and prevention measures, and that actually by 5 10. And now we want to adopt that excellent metrics of heat to farm workers, right? The US military organization is already using it, and large scale sports organizations are already using it to monitor it for athletes. And now, why not use also for the farm workers who are also vulnerable population? So, and unfortunately, installing WBG in the agricultural field is a little difficult for various reasons. Cost also logistically. So that's why we also do measurement or monitoring of weather models. So the benefit of weather models is that we do monitoring on a larger field at a larger temporal frequency, and most importantly, also allows for forecasting. That is what really save lives. So that's why we use this weather model to simulate and just wanted to show you. So again, irrigation is very important. global climate models that Europe often ignore these local details, for example, irrigation. But when you are looking at the local picture, you effect on the irrigation, right? And then the use factor is already said. So we apply the irrigation model to get more accurate estimates. And now, how does irrigation impact spreads? So this is also that is regionally to this particular area. What we saw is irrigation actually cools down or reduces WD in the daytime because there is evaporative cooling. Earlier, the body sweat, the evaporation of sweat also cools down, but water also evaporates. It also provides cooling. So that is why in the daytime we saw decrease in temperature and at night there is no evaporative cooling, but also the background humidity is much higher at night compared to daytime. So overall, experience the by wet. So and now, so how do we cope with the heat stress, right? So now one way is to take a rest break, and so monitoring the WBD in the field is difficult, as I said. So what we did here is we tried to calculate the rest breaks for farm workers in different seasons and different works because that is what gets right. So there are actually some guidelines which specify how much rest break we need in the outdoor environment, but they are based on exceedance above a certain rate of, let's say, take this much rest once the temperature exceeds, take this much rest break once the WBC exceeds this, right? So these are highly detailed guidelines, and the field will be able to monitor that. So that's why we look at the climatology. What is the overall incidence of these thresholds? And so if we account into that, then we can get the number of rest per hour. So that's what we do here, right from here specification. So we calculated the rest break requirements considering different indices, heat index, air temperature, and WBC. Clearly, WBC has multiple thresholds, and it shows the special and temporal values of rest break requirements in more detail. So we use that to derive a specification of the rest break requirement. So we looked into different work shift hours. For example, in summer, farm workers usually work from 6 a.m. So that is kind of more common work shift hour, but it's a variable thing, and we wanted to look at how does rest break requirement vary with start work shift. So we have different starting time, and also not only work shift, but also in different months. The incidence of those thresholds different seasons, right? So we wanted to take into account all these factors and the different rest break requirements. And also we can extend this to this method to include for acclimatized workers, non-acclimatized workers, because their needs are all and so just to show you some results, so heat stress WBC are actually exceeded most harvesting months, which are the harvesting months are the workers are out there, also there are some nighttime activities going on there. What we see is in summertime, even at night, that these thresholds are exceeded. But earlier, cooler months, April, May, which are actually the harvest season, these thresholds are exceeded in the daytime, not in the nighttime, but as the season progresses into summer, even nighttime, thresholds are exceeded. Now, heat exposure actually varies by crop environment. Again, it's changing schedule, and also there are different work potential. Those metabolic also varies in different crop environment, right? Farmers are engaged in some crops that are more demanding. Other crops like something that maybe it's easier, but harvesting, let's say, dates, it's a more difficult. It requires more metabolism. Right? So that also contributes to. Right? So we took into account these different timings of harvest and also the seasons of harvest. And we're able to get the heat risk window or diurnal window that shows different levels of heat risk. So when you see for different crops, their harvest times are different, so we see different level of heat exposure. So, and also now let's talk a little bit more about the acclimatization. So here we are showing reference to the guidelines. For example, there are two different guidelines called recommended alert heat, which is used for unacclimatized workers, and recommended exposure, which is used for acclimatized workers. So basically, when we are monitoring heat exposure, they should not be exposed to the level of higher than those curves, right? But as you can see, in many of the crop environments, these thresholds are exceeded. Certainly for acclimatized workers, these thresholds are higher, and but for unacclimatized workers, yeah, they don't have much tolerance to heat, so they need to be introduced gradually. There are certain guidelines how appropriate is exposing 20% every day, 20% of the time, every day in the work environment. By about 1 week, get that exposure. So these are the issues, and also so now using that concept, we also derived where are the critical crop, which crop zones are where is high heat exposure. So we were able to have different crops using this crop database. We know the location now, and also now we know when they are harvested and what season, right? So now this gives us an idea. Have is critical, and this is what is here. For example, crop with greatest grapes, the Coachella Valley, and also shows crop diversity and so different levels of heat exposure. So now, yeah, now let's also talk about the impact of this stress on labor production. As you know, workers slow down, and of course, breaks, and that affects the productivity, right? But what we see is that we can adjust the work schedule by a few hours. Let's say shifting the work schedule to early morning shift, starting at 4 a.m. or starting at 4 rather than the middle of the day. So that can actually reduce workers' productivity by up to 40%. That's what also let's talk about definitions. We have global definitions of heat waves, but are they relevant for the smaller areas or something offset? So so here where yeah, I wanted to look at the definition of heat wave. So uh, uh, California Code of Regulation, for example, has a definition that 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 identifies it works at when the temperature is above 26.7 degrees. Sorry, degrees Celsius, but that's 80 degrees Fahrenheit. And if that is if the daily maximum temperature for the day is greater than 10 degrees Fahrenheit compared to the previous 5 days. So, that is a heat wave. So that is how it is identified compared to a baseline. How much further higher is that compared to the baseline? And if it is more than 10 degrees Celsius, sorry, Fahrenheit, that is the heat wave, right? So, but that definition doesn't seem to work very well. Desert region, where the temperature actually is at very high level, but the increase is actually very gradual. So just compared to the previous day, you don't see that big jump, but the temperature is also high. So that's why I wanted to test another definition. For example, what I did, I looked into the temperature, the number of days, that's above 95 degrees Fahrenheit for 5 consecutive. So that is a figure, right? So and that kind of definition looks much better aligning with the actual response or actual statistics of heat-related kidney disease, and then you can see that bottom figure, so that better aligns actual. So that is yeah, some of the issues that we're working on. Also now talking about the prediction again. Prediction is very important at different times because it can save lives. So we wanted to look at what is the best predictor of the predicted. So we looked into different parameters, air temperature, long-wave radiation, and WBC. So what we see is air temperature does well. If it is simple, it can predict it is well. But but if we just look to a single factor, one way radiation seems to give a little better predictive power of to predict different part. And so those are on the bottom graph. On the top graph, what I'm showing here is, yeah, WBCT is also a good predictor of disease, but WBCT has certain issues. For example, if WBCT was developed in an environment of high desert region, the average level is lower, although there is some mitigation. So that's why I also wanted to think about calibrating this. Does this equation work all environment or different regional settings? And that is what we're looking at. So I looked at different combinations of these coefficients. WBCT has three components that I natural weight bulk has largest weight, 70% weight, black low temperature, the radiation component has 20%. But our results shows that humidity is actually less important, but radiation is much more important in the desert environment. So that is what we found. And so the coefficient that better matched with the predicted was 0.45 compared to 0.4 radiation, 0. Sorry, it was lower. But yeah, obviously this is data itself, even if are not perfect. But anyway, so that is kind of the direction working on, and also we're trying to now predict different illnesses, deaths, subsignals, you know, so with that, yeah, thank you very much.
Right. Thank you,
Yeah.
Doctor. I think that had some great insight because, I mean, as people living in Southern California, these people who are working in the fields are they're our neighbors. You know, we see these people every day. We cross paths with them, and so I'm glad to see some work being done there. It's definitely it's close to home for me. Thank you, Doctor.
Great. Yeah, thank you.
We are technically a little over time, but we're happy to take maybe one or two questions if anyone has any.
So, what technologies are the future innovation for the integration of placement? These type of technologies for capturing long wave radiation in the field.
So yes, we actually use this. There are sensors, which, yeah, takes into account the radiation already. We have those handheld crystal devices that we can use, but we also have with a larger black globe thermometer that actually provides um, the radiation from where it's on the radiation. But yeah, as you know, it's technically a little difficult. But yeah, so that's why we can also use weather models. The models can also formulate events on the radiation. Technically, those parameters provide better forecast.
Okay, those. We'll take one more quick question.
Thank you very much. I really found that WBGT very interesting. I've never heard of that before, but there's a lot I need to learn. My question really is from an individual's perspective, is the WBGT, is it the air temperature or is it how a person feels under the sun? That's the biggest predictor because I saw the correlation between ED visits. Which one would you say is we should look at to make sure that we stay out of trouble?
Yeah. No, thank you for the question. So yeah, it is something as weather service to answer, but no, certainly if we want to be more accurate, certainly I would recommend WBCT. I think there are different apps also available that actually, yeah, already provides forecast of WBCT. Currently, I think National Weather Service it index, but that is not adequate. Sometimes it takes into account the effective humidity. But if you are out in the sun,